Hi, my name is Daniel. I'm in BSN 266. This is going to be my tracheostomy care video. I'm going to go ahead and begin with my demonstration. And once again, I'm also with Nightingale University. Flame forward. So I verified my healthcare provider's order. I am now ready to proceed to my patient's room, knocking on the door, providing privacy. Hi, I'm Daniel. I'm going to be your RN today. How are you? Good, good. Can I please take a look at your patient bracelet to verify your identity? Thank you so much, Miss. It looks like Miss Tina Jones. I see a birth date of 11/15/1988. Last name Jones, first name Tina. Thank you so much, darling. Now, Miss Jones, your provider has ordered me today to do some tracheostomy care for you. So it's simple, darling. I'm going to be turning off your oxygen source, removing your inner cannula, putting it into some soaking solution, cleaning around the opening, which is called a stoma, applying a new sterile dressing, as well as removing the old ties and applying new sterile dressings as well. Any questions, darling? No? Okay, well, no? All right. And Miss Jones, given the fact that you will be, you have your trach, I will need to establish some sort of communication with you during the procedure if you feel uncomfortable or if you need us to take a break, to take a stop. You go ahead and raise your left hand if that's all right. Can I get a thumbs up if that's okay? Thank you so much for establishing and confirming that with me, Miss Jones. Miss Jones has already been oxygenated per facility protocol. Miss Jones has already been suctioned the tracheostomy tube per facility protocol. I've already performed those. I've also assessed Miss Jones's vital signs. Her stats are within her normal expected parameters. Her oxygenation, recently oxygenized, of 98. Her blood pressure is 110/72. She has a pulse of 76 in regular. Mrs. Jones's respirations are 14 in regular with no signs of dyspnea. Miss Jones, if it's okay, we're going to go ahead and begin. I've positioned Miss Jones at a position of comfort in that semi-Fowler's or that Fowler's position. Again, oxygen has been provided beforehand. I've taken care of that with Miss Jones. She's been pre-oxygenated. If indicated per facility protocol, I would be suctioning Mrs. Jones's tracheostomy if need be. I will be opening the sterile tracheostomy care kit, opening away from myself and away from Mrs. Jones, okay? I've opened and removed my necessary items for the procedure. Mrs. Jones, I will be soaking her, I will be making a solution with this basin by soaking solution in sterile normal saline into these basins. Excuse me, that's a tongue twister. Next, I've turned off Mrs. Jones' oxygen source, unlocked her inner cannula by removing it with that natural curvature, okay? And I placed it in the basin with the soaking solution of sterile normal saline. Next, I will be removing food, applying hand hygiene, only touching the pre-folded area, which is a 1-inch margin on the sterile gloves kit. Using my thumb and index finger of both hands, I will carefully open the sterile container, not introducing any pathogens to the procedure and not breaking sterile technique. Touching that 1-inch margin. Okay. Using my thumb and index finger to grab the outer area, not breaking sterile technique. cleaning around the site, trach site. Remaining sterile. Cleaning the inner cannula, staying in the sterile field, not introducing any pathogens or bacteria to the procedure. Boom. Wrapped it by grabbing the outside, securing it in place. It is now secured in place. I will be using sterile gauze to clean around the area. Both sides. Thoroughly cleaning around and inside the trach area, just the same way I was cleaning the stoma. Done. Okay, we've cleaned and dried off the patient's area with hydrogen peroxide mixed with the normal saline solution. If patient had dry, crusty solutions, crusty secretions, that does help to remove those. Okay, her skin is dry and no signs of moistness or skin breakdown is shown. Okay. Apologize, Ms. Jones, in the field. Usually this is an assisted procedure. Therefore, appreciate your cooperation. You doing okay? Okay. Staying in that sterile field, not introducing pathogens. Using the one-time method. Jones, are we doing okay? Getting it connected. Oh, there we go. I will be using my folded 4x4 and taping it into place. Checking for tightness. Everything is tight. I've assessed for the tightness, okay? I am placing the bed back into that lowest position. Remove my gloves, performing hand hygiene. I will be documenting the procedure, documenting the outcome, documenting how my patient tolerated this, and this is going to conclude my video. Again, this is Daniel Sapp. Thank you all so much.